on the extreme weather events and disasters, typhoons and flooding. And today I have three of my esteemed guests joining me to meet and greet you and impart their expertise, and I'll introduce them in a minute. But before we actually get to that point, I would like to introduce you to the overall course objectives. So the idea of this course is to actually increase health professionals' knowledge, self-efficacy, and communication skills related to the climate change and health. And really, while the course itself has ambition of meeting as many health professionals, we recognize that our audience is very diverse, but we hope that you will find all of our objectives quite relevant to the spheres in which you work. In addition to this, the objective and the ambition for the course overall is to expand the global workforce capacity to develop and implement educational programs on climate change and health, and really to provide you with a course of action that you can take and implement at any given time. Most of all, we would like to build and strengthen an agile and informed community around climate and health education, advocacy and policy, because the future of climate change is uncertain. And the more we educate people today, the more likely it is for the current and future generations to be able to respond to the climate change pressures as we are moving forward. So as I mentioned earlier, our session 3 today will focus on extreme weather events and disasters, on typhoons and flooding. And specifically, what we would like to do today is to actually focus on the ways in which climate change increases the risks of extreme weather events, such as typhoons, inland and coastal flooding in the region, but also to describe how climate change actually affects the hydrosphere, so the water sphere and the water quality, leading to the emergence and re-emergence of disease outbreaks, particularly those caused by waterborne pathogens, such as leptospirosis and Campylobacter, Salmonella, and so on. Mostly, we would like to identify short-term and long-term health threats to patients and communities impacted by these extreme weather events, and also what we as healthcare professionals can actually do to reduce these risks for our community. We also want to identify biological, social, and structural factors that make individuals and populations more vulnerable to health impacts from these extreme weather hazards, and also provide strategies in the context of resilience. Of course, finally, the idea is to define the roles of health professionals and public health officials in disaster risk reduction, communication, early warnings, and regional cooperation in the prevention of the health impacts of extreme weather events, and of course, all that linking back to climate change. So the logistics of today's sessions is that it's going to be a 90-minute session. It will include the expert lectures and today 2 case study presentations. These sessions will culminate with a question and answer section, so please feel free to use the Q&A function within this program to be able to pose your questions. And of course, we'll try and address those at the end of presentations today. Sessions, video recordings, slide decks, and resources will all be made available to you on the course website in due course. Of course, like all good courses, we have attendance requirements and the assessment requirements. So really, the attendance when you come, it's recorded automatically during the live Zoom session. Your individual attendance is only counted if you join using your personal Zoom link. So don't share it, and basically make sure you use your own. And your attendance is not counted if you join, of course, with a colleague's link. YouTube views will not be counted also towards your attendance. So you really have to be here in person, meeting and greeting with us and actually exchanging information. At the end of the completion, participants who attend 70% of the live sessions and pass the final exam with a score of above 70%, at the end of this course will be awarded a certificate of participation in climate and health from the GCCHE. Now, you need to know that the certificate of participation is only, again, available to people who use the same email for registration and all Zoom sessions and their exam. And like all good students, we want to know what's in that final exam and how we make it through. You, of course, make it through by coming to all the session, or as many as you possibly can, and above 70%. But the exam itself must be completed using, again, the same email address you use to attend your Zoom sessions. The exam link will be sent to you on the final day of class via email and WhatsApp, and will, of course, close on Sunday. The format is of 25 multiple choice questions and true and false questions in particular. You should be prepared to take the exam in one sitting, so getting ready for that too. So it is my great pleasure to introduce all our 3 speakers today. I will do so in one go. They are really highly accomplished people, and it's such a great pleasure to have them here. So please do forgive me if I actually read them off the paper because they're so impressive that I was very worried about forgetting something. So here we go. Um, it's my actually great pleasure to introduce our very first speaker, who is also our keynote speaker, Dr. Ronald Law. Dr. Law is the director of the Health and Climate Change Office at the Department of Health in the Philippines. In this pivotal role, he leads the development and implementation of national policies, plans, and programs focused on health emergency and disaster risk management. His leadership and expertise have been instrumental in guiding the country's response to major emergencies and disasters. In addition to his work at the national level, Dr. Law is a dedicated educator, serving as a professor of public health at prestigious institutions, including the University of the Philippines and the University of Washington. He shares his knowledge and experience on a wide range of topics, including disasters and health, health security, environmental health, health policy, and strategic management. As you can see, very, very impressive. Dr. Law's commitment to advancing global health and disaster preparedness has taken him across the world. He has completed fellowships in health emergencies and disasters in Australia, the United Kingdom, and United States, and most recently as a US ASEAN Fulbright Scholar on health security hosted by the University of Washington. And I'm very much looking forward today to learning from Ronald's extensive experience in this setting. Our second speaker will be Ms. Mere Naulumatua. Ms. Naulumatua is an accomplished urban planner based in Fiji with over 20 years of experience in urban planning and development. Throughout her career, she has made a remarkable impact both locally and internationally, having worked with the Department Town and Country Planning in Fiji, local governments in Melbourne, Australia, and on projects in the Solomon Islands and Samoa during her tenure with UN Habitat. Ms. Mere Naulumatua holds a planning degree from the Royal Melbourne Institute of Technology, or RMIT. Currently working as a freelance urban planner in the Pacific, Ms. Naulumatua is actively involved in several transformative projects. These include the Revitalising Informal Settlements and Their Environment, known as RISE project, in the Greater Suva area, led by Monash University, and an ADB-funded initiative to update the Greater Honiara Urban Development Strategy and Action Plan. Last year, in June 2024, she led a team to successfully complete the Climate and Disaster Resilient Urban Development Strategy and Investment Plan for Greater Nuku'alofa in Tonga. She is a passionate advocate for community inclusion, striving to foster a sense of belonging and inspire people to contribute positively to their communities. She's also committed to revitalizing the connection between urban planning in the Pacific and human health and well-being. And I had a wonderful pleasure of meeting Mary at COP28 and got to find out a lot more about her work. And I'm very pleased that she has that opportunity to share that with you today. And my final introduction is to Associate Professor Aaron Jenkins. He is widely recognized as Australia's leading planetary health scholar. And his work is focused on the intersection of environmental change and human health, spanning a range of cross-cutting development themes, including integrated conservation and development, watershed management for health and climate change mitigation, water and sanitation services, health rather, and waterborne disease management and sustainable fisheries. His expertise is also incredibly impressive because it's built on 28 years of professional experience in international development, collaborating with international and regional agencies, government, NGOs, donors, universities, and communities across the Pacific and beyond. His work has made a lasting impact in countries such as Papua New Guinea, Fiji, Solomon Islands, Palau, Samoa, Kiribati, Vanuatu, Federation States of Micronesia, Indonesia, the Philippines, and Australia and the USA. So I will stop talking now and pass you over to these incredibly capable people, and we'll start off with Dr. Law. Over to you, Dr. Law.
Thank you so much, Zerina. Magandang umaga. That's good morning from Manila, Philippines. I'll just share my screen. All right. Once again, hi everyone, and I really hope you're enjoying your journey of learning more about climate and health response in our beloved region. First off, I'd like to thank Columbia University and other organizers for this great opportunity to share. So my objective for this talk is to provide you with a brief but substantive background on extreme weather events, of course, with a focus on typhoons and flooding in the Western Pacific. With 15 years of experience, allow me to use my perspective as a policymaker, a practitioner, even a responder, as you will see, an academic, and most importantly, I believe as a Filipino whose way of life is defined so much by this topic: extreme weather events and disasters, typhoons and flooding. In the next few minutes, I'll do the following. First, I want to give you key concepts and trends of extreme weather events, typhoons, and floods in relation to climate change as they affect our region. Second, I want to stress the public health problems that arise because of this, because they affect our people in our health system. And third, using the Philippine experience, I want to share principles and strategies of managing typhoons and floods and building health system resilience to extreme weather events and disasters. And yeah, as you heard, there are two case studies that will follow and supplement this lecture. What is an extreme weather event? So we start with definitions. We have to look at the available definitions that we can use. And this comes from two very authoritative sources. First, in the special report of the IPCC on extreme events, or what we call the SREX, extreme climate or weather event or climate extreme is the occurrence of a value of a weather or climate variable that's above or below a threshold value near the upper and lower ends of the range. So I will not continue reading. It's so technical, but yeah, in terms of extreme weather events, there's actually no precise definition of an extreme. It can be defined based on the probability of something that's happening, or it can even be related to specific impacts. So, for example, a typhoon will develop in the next 4 hours. It can cause heavy rainfall, and it may trigger landslides in the northern part of the Philippines. So that's an example. So other aspects that may be considered are duration, the spatial area affected, timing, frequency, the date of onset, and other things. So we can relate this with typhoons and floods. So this can vary from place to place, and some may accumulate, and some may even be compounded. So therefore, they can cause more severe impacts. So let's do it in simple terms. Extreme weather is weather that is abnormal. It deviates significantly from the normal patterns. It is unusual or rare, occurring in a certain place and time of the year. It's also severe, thus it can cause harm or damage. And this is why we're interested in talking about this in public health, because we're in the business of saving lives. We need to know more about extreme weather events. So according to the Center for Research on the Epidemiology of Disasters, or CRED, extreme weather events are a specific subset of weather-related natural disasters that can include hydrological. So these are your flooding, landslides, meteorological, which covers storms, which is our topic, and extreme temperatures. It can also be climatological. So this includes droughts and wildfire events. This does not include geophysical events, your earthquakes and tsunamis. So typhoons, flooding, landslides, extreme temperature, droughts, and wildfire are extreme weather events. Earthquakes and tsunamis are not. Please remember this. But of course, we have to respond to all of these hazards. For this session, we're going to focus on typhoons and flooding. So by the way, these are actual pictures of typhoons and flooding that have affected the Philippines for the past 2 decades. Ondoy, Yolanda, Odette, pristine. These are their local names. I'm sure the Filipinos in attendance will be able to relate. If I may ask you, what's the link between extreme weather events and climate change? It is well established. It is unequivocal. So there's no doubt, as said in the IPCC report, that human-induced greenhouse gas emissions is the culprit. So don't get this wrong. Even with small increase in temperature, there can be massive changes in extremes. So when you talk about temperature extremes, heavy precipitation, tropical cyclones, and droughts. So even a small increase can mean a lot in terms of impacts. So with climate change in our midst, what do we expect? We should expect that extreme weather will happen with larger magnitude, increased frequency in new locations with different timing, and sometimes they can happen in new combinations due to what we call a compounding effect. So according to the World Weather Attribution, climate change is a key driver of extreme weather events. Climate change is contributing to the increased frequency and intensity of typhoons and floods. The CRED studied the 10 deadliest extreme weather events globally from 2004 to 2024. So that is around 2 decades, in fact, spanning my entire working life. This includes 3 tropical cyclones in the Indo-Pacific. Cyclone Cider affecting Bangladesh, Cyclone Nargis affecting Myanmar, and Typhoon Haiyan, of course, affecting the Philippines. There are also 4 heat waves in Europe, 2 heavy rainfall events. One is in India, one in the Mediterranean, and a drought reported in the Horn of Africa. So all in all of these events caused more than 570,000 deaths. So looking at this, what's the deadliest extreme weather event, at least in recent history? It's Cyclone Nargis in Myanmar, killing 138,366 people. The Philippine Department of Health deployed a medical response team to help out in the response to Myanmar. So Yolanda, our local name for Haiyan, is one of the strongest typhoons known to have ever made landfall. But not only in the Philippines, so accounts are saying even in the entire Western Pacific and even the world maybe. Many Filipinos died and suffered because of the super typhoon. I was part of the response team to Ground Zero, and it's really heartbreaking to see the impacts of this catastrophe with destructive high wind speeds, storm surge, and very warm sea surface temperatures that contributed to the intense storm. We can really say that the fingerprint of climate change is hard to ignore. A highlight on the Philippines. We had 6 consecutive typhoons. One is a tropical storm, actually, that battered our country, the Philippines, especially the northern part of Luzon, which is our biggest island, between late October and November last year. So this makes the definition, the description of extreme weather events very real. Yes, I know that you're aware that our country is no stranger to typhoons, especially during the wet season. But 6 in a row in the same part of the country, this is extreme. So according to the Japanese Weather Agency, this occurrence is so rare. It's saying that for 6 storms to impact the northern Philippines in such a short period of time, just 23 days, this is extremely unusual. You know what? The last time there were consecutive typhoons in the Western Pacific region, affecting again the Philippines, you know when it was? It was in 1951. So in that year, they call it the Pacific Typhoon Season year. There was a tropical storm every month except January. And all in all, there were about 16 typhoons, aside from numerous tropical storms and depressions. So going back to the present, based on modeling studies, at 1.3 degrees Celsius increase in temperature, you know what? This phenomenon, based on the studies, can happen once every 15 years. And the likelihood of three or more major typhoons, which we define as category 3 or above, making landfall in the Philippines in a given year has increased by about 25% just because of human-induced climate change. So why am I saying this? Extreme weather events are not an abstract concept or a faraway reality. Just looking at this Philippine experience with 13 million people affected, because some areas were hit at least 3 times, we reported 170 deaths and 1.4 million displaced. But no matter how low the casualty count is, relative to this train of typhoons, 170 deaths, actually even one death is one too many. These repeated storms highlight the vulnerability and exposure not only of our country, the Philippines, but also that of our region. And we're already at risk now. Let's look at the global trends. Extreme weather events reached dangerous new heights in 2024. So basically, it can be summed up with one word: record-breaking. So record-breaking heat caused severe heat waves, drought, wildfire, storms, and floods that caused record-breaking loss of lives, killing thousands of people and forcing millions from their homes. So hot seas and warmer air really fueled more destructive storms, including Hurricane Helene in the US, which was even stronger than Hurricane Katrina, and Super Typhoon Gamy, which hit Taiwan, China, and again the Philippines. So from Nepal to Dubai to Brazil, where we will have the COP this year, to the US, 2024 has been marked by a large number of devastating floods. Many of these were influenced by El Nino. However, most of the studies found that climate change played a bigger role. Last year, the Western Pacific region has experienced extreme weather events, typhoons and flooding due to climate change, and it led to widespread damage and displacement. So aside from back-to-back typhoons that ravaged the Philippines, in early September 2024, Typhoon Yagi brought intense rainfall, winds, flooding, and landslides to several countries in the Western Pacific. Uh, Again, affecting the Philippines, but this time it also affected Vietnam and China. Severe flooding and landslides occurred after a heavy rainfall in Nepal. And before I forget, in Australia, in sunny Brisbane, where I went for fellowship 10 years ago, severe flooding from Tropical Storm Alfred is still in the news. So we're done with extreme weather events as a hazard, how it is influenced by climate change, and how it's so real in our region. Now let's get to the impacts of typhoons and floods to our health sector. We're actually concerned with the following 8 Ds. Deaths and injuries due to drowning, trauma, physical injuries, electrocution, heart attacks even. Displacements of people, because typhoons and floods tend to affect very big areas, and those living in danger areas, thousands, millions of people usually may have to be evacuated. They have to be moved somewhere away from home, so their needs will have to be addressed. Diseases, which is our concern, which can be communicable diseases or even non-communicable diseases. So this can include waterborne, vector-borne diseases, because there may be breaches in water, sanitation, and hygiene. Sometimes problem with food, Of course, people are staying in congested temporary shelters, and airborne transmission of respiratory diseases can happen. And even those with chronic illnesses can have issues. So some may not have their maintenance medications. Some may not have access to specialized care, for example, dialysis. Destruction of health facilities, and even damage to supplies and equipment. So hospitals without roofs, walls, damaged X-ray equipment, and of course, when these hospitals are inundated by water, this can cause stoppage of operations. Disruption of health facility of services in health, which are basically the effects on our building blocks. So health workforce can also be affected. The supply chain, the cold chain, when there's no power, the bridges are broken. It's hard to transport commodities. The airport is destroyed, for example. All of this can interrupt the delivery of health services just when they're needed the most. The next D, distress. So aside from physical, uh, mental health issues can also take a heavy toll on people's mental health and well-being, and recovery may be an issue. A diversion of resources to response, recovery, and rehabilitation. The little money that we have is channeled to disaster response, leaving little for disaster preparedness and making investments. Even derailment of health reforms. Because resources go to response, we can run into financial issues, and we may resort to borrowing as an option. So this is very true for low middle income countries. People can get tired of responding left and right to these events. The health system can get overwhelmed, fatigued. And when the leadership is not good, any health reform, no matter how significant it is, can be easily derailed. So this is what happened when we experienced COVID. Although disasters should bring opportunities for development, usually after big disasters, especially after typhoons and floods, it's always a challenge how to rise up. So I believe these 8 Ds must be addressed when we talk about health sector response to typhoons and floods. In the Philippines, because of our experience, we are convinced that there's no such thing as a natural disaster. So Haiyan, Gamey, Trami, etc. All of these were meteorological hazards, but they were really boosted or supercharged by climate change. So they became extreme weather events that caused a lot of impacts. Aside from anthropogenic or human-induced basis of the issue though, so it's really our vulnerability, our exposure and adaptive capacities that should be looked into, because these are the things that may have turned these hazards into disasters. I'd like to show this illustration from the IPCC, which shows the interplay between extreme weather and climate events and disasters. So extreme weather events are influencers and determinants of disaster risk. So with vulnerability and exposure, and with interaction with climate in terms of natural variability and anthropogenic or human-induced climate change, this can lead to disaster risk. Development, on one hand, also shapes disaster risk. And on the other hand, strategies that we do on disaster risk management to reduce disaster risk and climate change adaptation, and of course, reduction of greenhouse gas emissions can also decrease disaster risk. So we need to address vulnerability and exposure, but also we need to do something about weather and climate events. And this should be an important priority of disaster risk reduction efforts. So basically, extreme weather events are physical hazards. Yes, they come from the environment, but the degree of disaster is really a product of the interactions between exposure to extreme weather events alongside the vulnerable conditions the vulnerable characteristics that predispose our communities, our people, even our health system to the adverse effects of climate change related threats. I hope this is clear. In a scoping review of extreme weather events in relation to health system resilience in the Asia Pacific, the following hazards were identified. And you know what? The top three most common that came out are floods, typhoons, and cyclones. No surprise. This underscores the importance of improving response capacities and building long-term resilience to typhoons and floods, which represent the most important extreme weather events that need to be addressed by our society, by our health sector. So this is not only true for the Philippines, but also true for the region, but maybe for the world as well. So the Asian Development Bank estimates that natural disasters, because of this, typhoons, floods, and cyclones are 25 times more likely to impact our people in this region, more than in Europe, more than in North America. So how should the health sector do its thing? With our mandate to protect and promote health in typhoons and flooding, what is the most important strategy to save lives in the event of dangerous weather? The answer is reducing vulnerability and exposure of our people and health system. Other than this, it's preparing to manage the health consequences of extreme weather and recovering from its impacts. So knowing this, the following should be done. Again, coming from the Philippine experience. So this is typhoon. So follow the acronym. Typhoon and flood early warning systems. So with systems in place and data that's available, we need to alert people to take precautions, to secure their houses, of course, the family, their belongings, and they need to evacuate. They have to move to temporary shelters to keep them, of course, out of harm's way. They also need to prepare supplies. In case of health facilities, they also need to be alerted to prepare their emergency rooms, to deploy response teams. The second one is yearning for data. So data is very important to inform our assessment and surveillance because we're concerned about the diseases, right? So we need to be detecting health issues, monitoring health trends in the community, in the hospital, in the temporary shelters in order to prevent outbreaks of diseases. Public service continuity plans. We need to ensure that lifelines like food, water, energy, communications are available to deliver basic services. So we need to work with the social sector, infrastructure, education, peace and order. And of course, in terms of health, public health programs need to be continued. Nutrition services, prenatal and maternal care, of course, immunization, our tuberculosis program, hypertension management, all of this must remain uninterrupted to prevent additional mortality and morbidity. Health facility integrity and preparedness. Hospitals need to be safe. They need to be free from hazards themselves, of course. They need to be structurally sound. They need to be prepared, ready to deliver health services. Through inpatient, they get patients, outpatient, and emergency care. And referral systems must be in place. And there has to be seamless coordination with different kinds of facilities, whether government and private. The next item is very important. Organized mass care and sheltering for displaced people. So what are we going to do for people inside the temporary shelters? We need to take good care of them because, again, the conditions are not good. It's conducive for diseases, for injuries. So we have to provide medical relief and look after their needs so that they are able to maintain their health and prevent diseases, as I've said. We need a holistic, one government, one society response because floods and typhoons are big disasters. So we need to be able to cover all aspects of response. We need to involve relevant sectors, agencies, the private sector, civil society, academia, and even international partners just to be able to cover the requirements and demands of emergencies and disasters. And lastly, we need to have novel approaches in communicating risk and promoting health, targeting specific audience, trying out different forms of media, social media, traditional media, customizing messages, and exploring ways to influence the behavior of people. So let's remember typhoon. So this is how our health system should conduct its response to typhoons and floods. But aside from merely responding to typhoons and floods, the health sector should also seek to develop long-term resilience to these hazards and to extreme weather events in general. So the following measures should be pursued. This time, the acronym is floods. I want to start with financing and investment for extreme weather event preparedness and response. This is critical in low and low middle income countries whose infrastructure and systems can benefit from upgrading and where some logistical provisions could be important. Learning iteratively from past lessons, our current experience, and considering future projections. It's all about really being smart from all the experiences, including the good ones and not so good ones. So the health system should think on its feet, navigate the future, even if it's uncertain, and with this learning, really do things better, organizing the communities for action. So we have to capitalize on the power and strength of communities. In the Philippines, we call it the bayanihan spirit, cultivating positive attitudes and beliefs in what people can do and building their capacities for resilience. The next O is offering protection to the most vulnerable populations. So extreme weather events and disasters actually further drive health inequities. The poor, the underprivileged ones are also the oppressed, the marginalized. We call them the victims of extreme weather events, but that should not be the case. Those who are the lost, the last, and the least, they also happen to be the most vulnerable to extreme weather events, so their needs must be prioritized. Driving decision making through data and evidence. So statistics, numbers, and even stories are all important pieces of information that should guide decision making in terms of policies, programs, the way governance and administration is done in responding to the challenges of extreme weather events. And finally, we need to strengthen further the competencies and capacities of the health workforce. So in the literature, this resonates the most to people when we talk about health system resilience to extreme weather events. Not a surprise because the health workforce faces a lot of challenges in doing their duties. And in fact, they face additional burden because of climate change. And yet, they are highly vulnerable and, shall we say, lacking also in terms of competencies and capacities. So they should be up to the task. So we need to do whatever we can to change all of this. So let's remember floods when we talk about health system resilience for extreme weather events. So now that we already know our typhoon and floods, I mean the hazards and the acronyms, responding to this and building long-term resilience, I'd like to also share on a final note that it is also necessary to do comprehensive climate and health actions to address extreme weather events and other climate change related health threats. So aside from adaptation, building more climate resilient health systems, we also need to do mitigation. to reduce our carbon footprint and aim to be sustainable in order to lessen the negative environmental impacts of our health system to the planet. So allow me to give you a glimpse of the Philippine roadmap for a resilient, low carbon, and sustainable health system. This is our approach, transforming our health system to be climate smarter. For the details, because we're limited by time, you can go through this after, since I'll share with you a copy of my presentation. So for the last 20 minutes or so, I was able to convince you that extreme weather events are real, that they're so much related to climate change, that typhoons and floods already killed many people in our region. Therefore, our health sector must be resilient in managing the short-term and long-term impacts of extreme weather events and disasters. So the picture is a nice sight to see after our loaded discussion. So summer has just started in the Philippines, and for me, still the best time of the year. And lovely attractions like this one are calling me and you. So come visit the Philippines. And if you want to know more about the Philippines and the work that we do in climate and health, you can reach out to me for collaborations. And you may also check out my LinkedIn so you can monitor what I'm up to. So again, my pleasure and honor to share. Thanks for listening and looking forward to the Q&A later. Thank you. Maraming salamat.
And just calling our next speaker, Mere Naulumatua. Thank you, Mere.
All right. Easy, easy. Can you hear me?
Yes, we can.
Okay, excellent. Slowly. All righty. Thank you for this opportunity to speak at this responder course. For those of you, I always get questioned as to what's an urban planner doing in a health-related course. But so I always tell the story of how, if it wasn't for the cholera outbreak in the 1800s in England, the wastewater treatment system, the reticulated wastewater system that we enjoy today would not have been incorporated in urban planning. So that's where the relationship between urban planning and health started from. We were always together, but somewhere along the line, we drifted apart, and I think there's no better time to start bringing the two professions together. Did I say hello from hot and muggy Suva? Just a very quick one. Fiji is located about 2,000 kilometers north of New Zealand, so we're technically in the South Pacific. We are a country with a population about 900,000 across 300 islands, 110 of them inhabited. 54% of the population is urbanized, and 20% of this population live in informal. 20% of the urban population live in informal settlements. As you can, my case study will be on informal settlements. The water supply, just very briefly, 100% of the urban population, we have access to treated reticulated water. And for those in the rural areas, rely on rivers, streams, and rainwater or borehole. Access to reticulated wastewater treatment is available, and most people still use septic tanks. In the informal settlements, of that 20% of the urbanized population, We are all aware that these settlements spring up in marginal areas where there's steep slopes, swamps, poor drainage, and flood prone. It's overcrowded, and access to good drinking water and sanitation services are indeed limited. I will be speaking about the RISE program, which is being piloted in 12 settlements in Greater Suva area, Fiji, and another 12 in Makassar, Indonesia. So the RISE project, in total, 1,200 houses, about 7,000 people. It's a research action project, and it's out to disrupt the pathway between the environment, the pathway of passages from spreading from the environment to humans. Really, we are at the middle of the big infrastructure type developments and the WASH solutions. So
sorry, Mary, we can see your screen.
You can or you cannot?
I cannot.
Oh dear.
So just share the screen down on the bottom.
If you want, I can share for you.
Okay, sorry. Oh, this is not good.
I think we're here. See if we are right. Yeah?
Okay, where am I? Yes, okay.
So tell me if you want to go to
the next slide, please. Yeah, I was here. Next slide, please. Okay, yeah, I'll start again from here. Sorry about that, folks. No, back. Correct. Yeah, stay here. The RISE project has two components. There is the intervention, which is the build, where we are trying to connect households to a system within the settlements. So some houses, unfortunately, do not have proper toilets. We have to come in and build these wet pods, we call them, so it has a bathroom, toilet, etc. The other is a pressure tank, where we have a series of perhaps a cluster of 6 houses connect to a pressure tank, and then it goes onto our decentralized wastewater system. I'll talk a bit more about this later. Now, the second component is about research, where we're collecting samples from children under 5, whether it be blood samples or stool samples, and also from the environment. It could be water samples and soil samples, and even mosquito breeding grounds and vectors and bird sounds. One thing, as Zerina had mentioned, I advocate for good community consultation. So this project really speaks to me in that we always involve the community in the decision making, in the design, and at every milestone we go back to the community and talk to them about it. So picture on the left, late night, talking to the community. Our other stakeholders in government, we update them often as well, because we need their buy-in, particularly for funding. Next slide, please. I think connection today is not happening in the islands. Okay. So for the component one, the build, we have many interventions, one of them being raising the boardwalk so that the settlers, the residents, do not have contact with the contaminated ground as they go from house to house. Also, this during a time of cyclones or as such, they still have access in and out to go to evacuation centers. This is our wetland, a nice, rather healthy wetland. Our plants are doing the job as they receive all the good stuff, and then it goes through a series of subsurface and wetlands before it gets released back into the environment. Next slide, please. Okay, once again, just the wet pod I talked earlier about. Many residents in informal settlements require a lot of help, so we come in and just do that, so that what we are doing is containing the wastewater in the community so that it's all contained and does not leak into the environment. So some houses get perhaps fix their leaky tank, showers, and even a water tank for their households. And next slide, please. Okay. The picture on the left shows the location of the pressure tanks within a community. So we are able to tell, we get notified of if a pressure tank is not working or is working. So inside these tanks, we have a little pump that grinds all the good stuff and then pumps it to the communal septic tank and then onto the wetlands. Next slide, please. And in a nutshell, this is what the system looks like from the individual households, perhaps 6 households in a cluster, to a pressure tank, then onto the communal septic tank, then subsurface wetland, a surface wetland, and then out into the environment. And of course, by then it is much, much cleaner than at point 1. Next step, please. Okay, community consenting as part of the project. There's community consenting, household consenting, community co-design, ground truthing, and the residents are part and parcel of this, the whole process. So by the time the system is up and running, we've gotten their buy-in and they help with maintaining the plants and the wetlands. Next slide, please. Okay, so of course the RISE project has multiple co-benefits. It's in protection from flood hazards, sanitation, the water quality improves, water sources, whether it's harvesting from stormwater, and productive landscapes. Next slide, please. Okay, before I go into this last one, I didn't link it. I think I missed it when I was told that my slides were not showing up. But the cyclones that we receive, that we COP every year, we have a season between November and April, which is cyclone season here in the islands. And recently I have, well, in my own lifetime, that the category 5 cyclones are becoming more frequent. One was in 26 and 2020, there were 2, one in April and one in December. So while our numbers of the death toll is very small, maybe 44 lives, 1 or 4, it still does impact communities, whether informal, formal, rural or urban. Another event that we experience here in the islands is heavy rains, which causes flooding and landslips, and of course storm surges. And in particular, if they coincide with high tides and king tides, that's when the communities are impacted greatly. So after these events, usually the land is saturated and water is sitting. So the interventions of the RISE project really help people to get up quickly and move on with their lives instead of having to suffer at great lengths, wading through floodwaters, etc., or waiting for the floodwaters to reside. So of course we have diseases that can become an issue, leptospirosis, typhoid, dengue fever, diarrheal diseases. Those become quite prevalent during this time. So the RISE project, why we are piloting it in informal settlements, because they are the hardest of all settlements. These are people who are already marginalized. They're poor, their voices are not heard, and services are rarely provided to them. So now I come to maybe my second last slide. This is objective 5, where through our consultation with our key government stakeholders, we have been able to, the Water Authority of Fiji have stated in their 2050 strategy that they will use the RISE decentralized system to service out of sequence residential developments. Also with policies, In the beginning, we had to get over a lot of hurdles in approvals of our interventions, but because we were linking our interventions or the build to improving health and well-being, the Public Health Act was able to address, and our application, and that's how things got approved. Of course, SOPs to accompany the town and country planning general provision was formulated and has helped us a lot in the approvals of our building plans. I think that is all that I have, and I'm open for questions later on. Vinaka Makalevu.
Thank you, Mara. And I think our final speaker is Associate Professor Aaron Jenkins. Aaron, over to you.
Greetings. Can I ask you to start your video? Start my video. Okay. What can you see?
So we can see all of your slides. Aaron, if you don't mind going to the presenter's view, we should be able to see that.
Okay. Let's see. Okay, that's the platform around. Okay. All right.
Thank you.
Greetings. Bulavanaka, ladies and gentlemen, that's a greeting in Fijian. I'm also based generally in Fiji in a complementary program of work to the RISE program called WISH, which is Watershed Interventions for Systems Health. So for those of you who don't know me, I'm Aaron Jenkins. I'm a Horizon Fellow, Associate Professor in Planetary Health. I've been introduced. I'm at Sydney School of Public Health and also Fiji National University's Fiji Institute of Pacific Health Research. I'm a proud Fijian citizen and Eastern European native North American Cherokee, and I have lived and worked for decades with the communities of the Pacific on community-based approaches to systems health. And I'm very happy to have this opportunity to present to you this brief presentation as it relates to my primary research program, which is WISH, as a case study. So as you know, climate predictions for the Pacific Islands suggest that this region is going to continue to experience increased intensity and frequency of extreme weather events due to climate change, rising sea temperatures and changing atmospheric conditions are expected to contribute to more severe tropical cyclones and heavier rainfall. This trend aligns with the global observations that intense tropical cyclones are becoming more common with each degree of global warming. These projections all translate to greater flood risk impacts, and the flooding following cyclones and prolonged rainfall has already been linked many times to outbreaks of a variety of waterborne, climate-sensitive bacterial diseases such as typhoid, such as Shigella, such as leptospirosis. And in this example from 2012, Fiji was impacted by sequential tropical depressions that caused widespread flooding. And these events, they resulted in substantial population displacement and significant post-disaster increases in leptospirosis cases 3 to 8 weeks following each of the major flooding episodes. So around the same time, we produced this model of how the combined effects of watershed modification. Watersheds are also known as catchments or river basins, the places across the land in which water flows. So where you see the modification of those river basins in various ways, and you get more intense cyclones and heavy rains, they begin to create this perfect storm of conditions that leads to outbreaks of water-related disease, and also negatively affects human well-being through a combined impact on both food and water resources and place itself. So that's a very linear way of looking at things. It's quite this is nonlinear complexity. And as a way to engage with that, we conceptualize natural systems as nested systems. There are risks present and opportunities to act within each of the nested and connected subsystems, from the global climate system to the environmental and social context, the residential settings and individual behaviors, to organs, to the unicellular organism, and even the genetic mobile elements that work together to regulate health. So interactions between the scales in systems ecology are considering, these downscale interactions. We call them remembering, because they're drawing on the biotic legacies of large, slow processes like forest assembly, for example. And revolt is the upscale connections from the smaller scale, faster processes, such as microbially mediated disease outbreaks. We could use COVID as an example there, for example. So in short, our Fijian studies and those of our colleagues in the following years showed that amplified typhoid, leptospirosis disease, and diarrhea associated with vegetation removal, erosion in watersheds, proximity to flooded areas and livestock, the upstream conditions of watersheds, so the places that were more forested, also helped to predict childhood diarrheal disease. So the more forested it was, the less diarrheal disease downstream. Evidence to guide both the natural and the built infrastructure interventions in these watersheds is therefore critical for water and sanitation management, as well as any other downstream ecosystem services, such as flood mitigation during these adverse weather events. So as Mara was saying, Fiji gets hit constantly. We got hit by, in February 16, by Cyclone Winston, which was apparently the second largest cyclone ever to make landfall after the Philippines, causing massive damage to drinking water and sanitation infrastructure and to watershed systems in Fiji, with several outbreaks of typhoid and leptospirosis in the months to follow. What happened is that the coordination and prioritization of response was hampered by a lack of integrated information between health, sanitation, and water quality. And so with some funding from WHO and UNICEF, I started to work with the Fijian government to start building a system which can integrate drinking water quality information, sanitation facility monitoring information with health risk surveillance systems to help both enhance and prioritize the recovery and response. So this began pretty well, and then it generated some good intersectoral willingness, but it petered out as the cyclone response funding also dwindled. And then afterwards, with some support from the Australian Department of Foreign Affairs and Trade and Bloomberg Philanthropies, we're able to tie these various threads together of work into what has now become this highly transformative and innovative watershed interventions for systems health program, which I lead, which uses place, and place being the watersheds, as a focal point for health and well-being. Our first PhD graduate from our WISH research program published this notable paper that explores how weather patterns like rain and seasonality, including those cyclone and heavy rain events, can predict disease outbreaks from the syndromes that are associated with those climate-sensitive water-related disease, such as leptospirosis, typhoid, and dengue. And so by analyzing the syndromic surveillance data from 2016 to 2020 against the weather patterns, she found that by tracking when and how much it rains, we can forecast the likely times for disease outbreaks, and which helps in planning our timely healthcare response. But Climate-sensitive disease, infectious disease, and contagion in that sense are only one of the most obvious parts of the story. In the public health space and in the public discourse surrounding climate change and well-being of Indigenous peoples, the notions of loss of place and place attachment aren't really considered as drivers of Pacific Islander well-being. And I'd like to share a quote from a recent paper highlighted here that I think encapsulates what place attachment or place-based approach means from a Pacific Island perspective. Indigenous peoples don't see themselves to just belong to a place. Rather, they often see themselves as embodying place itself. The term Venua from New Zealand, Enua from Vanuatu, Whanua from Tonga, or Vanua from Fiji, for example, refer both to the land and to an ancestral connection to the land. And so words for land and dirt are often synonymous with words for placenta, actually. And as such, suggest that life and land are intrinsically connected. For a whole myriad of Pacific cultures, the common practice of returning the placenta to the earth further embeds this notion of being of the land. Such a connection means, I advanced too quickly there. Such a connection means, wrong direction, sorry. Such a connection means that any radical transformation of the land or separation from it, be it through voluntary or involuntary displacement, is likely to catalyze loss, a profound sense of loss, profound identity loss. So our WISH program, recognizing that managing watersheds holistically, these places as places of land, is the key to simultaneously achieving various environmental, economic, and health goals that support sustainable development. This approach allows for targeted actions that improve overall systems health tailored to each community. Sorry, it keeps advancing. In these contexts, place attachment driven by strong desire to maintain cultural identity and practice incentivizes local Indigenous folks to take action that support the key dimensions of health and well-being, which includes maintaining and restoring ecosystems that provide critical services and natural resources that underpin cultural vitality and community health. The WISH Fiji project implements a 7-step adaptive management process to address these nested risks across watersheds, communities, and households. And this process began with a participatory watershed selection, integrating national workshops and stakeholder input, which is step 1, followed by community level engagement through free, prior, and informed consent. Step 2, data collection and risk assessment. Step 3 through 5, informed tailored interventions supported by communication tools and community-driven water and sanitation safety planning. Step 6 and 7. And by addressing these interlinked social and ecological factors at multiple scales, this approach ensures context-specific, place-based, iterative responses to mitigate water and sanitation-related health risks effectively. So here you can see in this risk factor table the different nested scales at which risks for systems health are acting and where they're common for multiple diseases. The L is for leptospirosis, T is for typhoid, D is for dengue, and as an ecosystem service, we're talking about corals and coral disease downstream. And here you can see that there are clear efficiencies to be gained by acting on the risks at multiple nested scales and where risks are common to multiple diseases. So here you can modify your environmental risk at a number of different scales, nested within a watershed, and be addressing multiple outbreak-prone climate-sensitive diseases and addressing downstream ecosystem health at the same time. So we walk through this step-by-step participatory process within each of our communities. We have 29 communities that we're working with to develop water safety and sanitation plans where different priorities for management are identified. And some of these interventions are nature-based, and some of them might involve putting in new infrastructure, like this water reservoir that can provide a flow of clean water to households in the village. This figure illustrates the measurable reductions in risk across 5 key factors following our interventions that include improvements in drinking water quality, reduction in E. coli levels, increased hand washing practices, and about 154 different interventions were implemented across categories like water systems, land use management, and hygiene. And there was progress achieved despite the challenges such as delays in sanitation, infrastructure upgrades. So this cross-sectoral approach spans nested scales, addresses risks from watershed to household levels, and it incorporates nature-based solutions alongside behavioral and infrastructural improvements. This integrated kind of portfolio approach highlights the potential for long-term systems health improvements, although with variable impacts and timelines depending upon the socioeconomic and the geographic context. Fiji has been, as Mera was saying before, has been through so many cyclones since we began this project, which caused widespread flooding, damage to infrastructure, including the water and sanitation facilities, and distress to people and animals who are often crowded into evacuation centres. And this was even during COVID when they were trying to enforce social distancing and hygiene. And our primary support here has been for our team to provide a series of training courses for many of the health inspectors, and particularly on how to use and maintain these portable labs to test water quality in remotely affected areas. Also, after the recent volcano in Tonga, we also provided support to test the acidity of water supplies affected by the falling ash. In a kind of a final note here, in all of this, it's very important to recognize the critical importance of nature conservation as a public health intervention. As part of our WISH work, we have been partnered with several conservation NGOs, and one of the great outcomes has been the commitment by communities to establish large forest reserves, one seen here on the islands of Ovalau, protecting the headwaters and serving all the downstream communities, also helping to reduce their risk to climate-sensitive flooding. And we're working on getting similar commitments across all of our different catchments. That many recent studies, they show that the proximity to and the coverage of protected areas and nature conservation areas is associated with a decrease in the incidence of diarrhea, typhoid, and acute respiratory infection. And children living that close to protected areas have a higher weight for age score and are less likely to be stunted. But one of the most important and compelling narratives here is that such nature conservation approaches are undoubtedly the most cost-effective and efficient means of preventing the next pandemic. The importance of nature conservation for climate-sensitive disease, as well as pandemic prevention, as well as to achieve a multiple of public health and well-being outcomes is obvious. And it's surprising how slow this narrative is gaining traction given the global circumstances. So I think I'll leave it there, and thank you very much. And here you go.
Thank you, Aaron. Let me just pull the questions onto my screen so I can read them for you. So we have a very large volume of questions that have been posed to all three of our speakers. And what I thought I would do is, instead of focusing on one speaker predominantly, is actually issue one question to each of the speakers. And then hopefully we'll try to get through as many questions as we can. So I'm going to start with Dr. Ronald Law first. There's a really good question here for you, Ronald, that says, from Gerald Finnegan, why has there been such little emphasis on changing the health service delivery model away from centralized structures of care for the new climate reality, when decentralizing secondary and tertiary care would reduce both exposure and vulnerability dimensions?
Thank you for that interesting question. Yeah, that is part of some considerations. Yeah, Mayor shared a lot about the perspective on urban planning, so that has somehow been considered. For example, decongesting Manila, for example. So people are settling in because there's an important trend in the Philippines because of economic opportunities. People from uh, provinces would tend to flock to Manila. So that has been one of the big challenges. But of course, in terms of health service delivery improvement, so that is very much a priority of our government. Of course, for many administrations to decentralize health better. So we have developed our system since the early 90s. But in our pursuit of universal healthcare, yeah, I think this is some important consideration that we are having as well. So disaster risk reduction is a top priority of the government. So national and local governments, more importantly, are also doing a lot in terms of this. So it's not only national government addressing this. So local governments are have the mandate. They have all the resources now to manage this. But again, where people should be, where people should have these economic opportunities, should be an ongoing discussion also with other sectors, looking at the risk profiles of of many communities. Thank you.
And I guess the healthcare system is such a complex system in its own right that actually decoupling the centralized care into new models would require a whole range of new processes and implementations and evaluations and quality and safety indicators that would sort of be a massive undertaking as well, which is quite challenging considering that we just got out of the COVID-19 pandemic as well. Mara, I'll pass over to you with the next question from Adrienne May Perez. Thank you for sharing the information on the RISE program. I'm curious to know, how was the process in co-designing efforts to empower the community members to participate and contribute something to the program managed?
Okay, good question, and I'm very happy to answer it. Strange enough, when we went into the settlements, these are people who've come to the urban areas from many parts. They're not all one part of a family. They're everybody and everybody. So, but we were surprised to find that there were networks within communities. So maybe it's the church group, the women's group, the youth group. They were already well established within the communities when we came in. So what we did was have a community meetings, and they organized themselves to say, okay, this is the big committee. And then we would talk to each of them. Sometimes we would speak to the women separately or the young people separately, and then come together with their representatives to the main meeting, which would happen. Now, as the RISE started rolling out, then the water sanitation committees were formed. When I talked about those clusters, that cluster formed a little subcommittee. So if something went wrong with their pressure tank, they knew it was only those 6 houses that something happened there. Everybody else's pressure tank was still moving. And so as our pilot site is working very well, and there are 2 other sites that are up and rolling. And so the communities are well organized. And when something happens that they cannot fix, they contact us through a number, and Water Authority gets contacted as well. So it goes back to how we have talked about it, gotten consent and everything, but every step of the way we have consulted with the community. We've allowed them to ask all sorts of questions, and we've answered them, as best we can. And sometimes we can't. It's not easy. Sometimes we can't, and sometimes there are fights. There's a lot of vulnerability. We have gone through 2 elections during this time that RISE was starting up, and it's being asked, oh, is this another election thing? Another example I would like to give is within these communities, how they were so well organized during the COVID, when there was lockdown. Services could only come to the boundary of these settlements. So it was easy enough that the medical services came to the boundary, and then representatives from each of these clusters within the community just did their work and and spoke or shared whatever it was to be shared to their little cluster groups. So it worked out well, and that's how we've been very successful and gotten the buy-in of the community so far.
Yeah.
Fingers crossed, nothing bad happens. Yeah.
So sort of having trusted community messengers as well to act in between. It's an incredibly important point in co-design. Aaron, I'm going to go to you with the next question from anonymous attendee. Fragmentation between health and water agencies poses a significant obstacle to developing comprehensive integrated water resources management plans. In the Philippines, for example, approximately 30 agencies are involved in water and sanitation health. What would be the solution to address this? Are there examples?
That's a fabulous question, and it speaks to the fragmentation between many of the sectors, not only just between WASH and health, but between environment and WASH and health, and many of the other sectors that impact on WASH and health. So the example that I can give is really it's developed from the WISH program. It came out of it was built from the Cyclone Winston in 2016, when in fact we saw that in order to respond, you had to be able to see where outbreaks were occurring, where the water was down, where the sanitation was down, where the places were most affected, all at the same time in order to prioritize your response. And so what we see often, and this is that in times of crises, right during the period of crises and right after the period of crisis, that the different sectors come together and they work together and they can provide information together. But during peacetime, let's say, people go back into their silos again, and they don't have that same degree of cooperation and collaboration and sharing of information. And so what we really need to be striving to do within our governments and our communities is to be able to have that same level of intersectoral collaboration and being able to view those different bits of information together at the same time in peacetime, not just in the time after a disaster. So in Fiji, what we were able to do was we were able to get a piece of legislation passed for an integrated drinking water quality committee. And that integrated drinking water quality committee has a remit to provide, the basic human right of clean drinking water to every citizen in the country. That's regardless of whether you're in city, you're in an informal settlement, or you're out in a rural community. And so the various sectors that are involved in providing drinking water or clean water ranges right across from health is chairing the committee, but then you've also got Department of Environment, you've got Department of Agriculture and Waterways, you've got Department of Water and Sewerage, you've got Mineral Resources Division, you've got a whole variety of different sectors that all have something to say about the quality of water and have information to provide around that. So what we've basically done is we've helped government to create a space, a space that's mandated for that information to be shared together around a certain topic. And that particular certain topic is drinking water and providing clean drinking water. And it acts as a focal point and an example for how to do intersectoral decision making at a national level around health and well-being in using all of these different sectors. So hopefully that helps.
It sounds very complex to me, I have to admit. Definitely, it sounds great. Back to Dr. Ron. I'm going to combine two questions for you, Ron, because they're quite similar. The first one is, why is the Western Pacific region so vulnerable to extreme weather events? And the second one is, can we get your opinion on increasing number of heat waves, especially in the Philippines? How will us, the climate responders, alleviate these heat waves?
Yeah. First, it has some on being hazard or disaster prone. It's because of the location, Western Pacific region, where most of the strong typhoons really form because of the warming of the surface of the seas. And this is really the tendency of typhoons. They usually go to this part of the world. However, the behavior has been uh, becoming more extreme. So that is very true for the Philippines because we lie on the what we call lie along the typhoon belt. So that is very important, the geographic location. But more importantly, yeah, the geographic exposure is very important. The vulnerability, the exposure, but the vulnerability is equally important. The vulnerability of our people, socioeconomically, the quality of our health system, and many other stuff. And then heat waves are real as well in the Philippines right now. So our weather agency, we're not yet the the formal summer season hasn't really started. It will start soon, but last March 1, our weather agency already came out with heat index warnings that are dangerously high.
Mm.
So we need to protect people better. So we have been responding to a lot of this for the past few weeks. So doing a lot of communications campaigns. So as climate and health responders, we need to know better the science of heat events. First, it is extreme. It's abnormal. And although this year we're not gonna have an El Nino, we need to brace ourselves for extreme heat because much of the time we know it is because of climate change. So extreme heat is something that should be addressed by long-term resilience. I guess that should be true for our country and for the rest of us in the region and even globally. So classes are being canceled, work suspensions are happening left and right. So the health sector must issue very sound guidance as well. So moving
Mm.
forward, we want to work with other sectors, especially the education sector, because it's not sustainable if, it somehow
Yeah.
affects learning as well for students. So urban planning is important. We need to go back to the structures of our health facilities. Of course, you can always give guidance on hydration, cooling, but these things are quick fixes,
Mm.
So we need
Yeah.
to focus more on the long term and really acknowledge the fact that extreme heat, just like extreme weather events, are going to be a thing in the now and in the future because of climate change. So this changes a lot of things that we need to do in the health sector.
Mm.
Thank you.
I think your response highlights this really important fact that we all need to remember, that health responders are not on their own, and this is a really interdisciplinary effort that requires all of us to come together, whether we engineers, urban planners, public health officials, policymakers, etc., to be thinking about strategies that would act towards helping community adaptation, resilience to events such as heat waves or extreme weather events overall. We've got 2 minutes left. Just before I close the session, I think the organizers will be reaching to each of you with some of the questions that they've collected for you to answer offline and to provide, and they will provide it later on to the participants. But I was just wondering, just before I close, if there is a final sort of message that you would like to give to the climate health responders in this course now. Shall we start with you, Aaron?
Yes, thank you. My final message is that, the effects of climate have to percolate through the environment, and the effect, whatever's going on in the environment, in that social environmental setting, affects people and in different ways. And so the best way to mitigate the effects of climate and to protect us is to manage your environment well. And so nature conservation, improving the amount of green space that you have, all of those things will help mitigate the health effects of climate. So please think about managing your environment as a public health intervention. Thank you.
Mary?
Okay. while the heat wave is still in my head, of course, heat islands as an urban planner, I think with climate change becoming more intense, I mean, the impacts of climate change, I think as urban planners, we need to design better places to live and work and play. So greening not only the rural areas, but urban areas need to use more natural systems so that the impacts of these events are not greatly felt. Thank you.
Thank you, Miriam. And Dr. Ron?
Yeah, again, I'd like to reiterate the fact that climate change and extreme weather events are real. It's not a faraway reality. It's happening in the here and now, and it really affects the way we live now, and even that of our kids. So, just a couple of points. It's beyond disaster management. Extreme weather events, they're not really natural disasters, so we have to do our best at managing them. So beyond disaster management, we need to go back to the causes, the reasons for this, because aside from adaptation, which is great, we need to do a lot of adaptation. Mitigation is also important. And number two, I think it's beyond the health sector, although there are many issues related to health, but we need to go beyond the health sector. We need to look at conservation, things that we can do in the environment, the natural habitat. One health is very important, and we need to be very multidisciplinary. So at the end of the day, we care about health issues, but the way these solutions are going to be developed or created, most of them are nothing new. So we just have to, get out of our own backyards and acknowledge that fact. So thank you so much.
Thank you to all three of you. I am going to share my slides one more time, which I believe you should be able to see. So thank you very much to all of you for joining in. Just a reminder that you can join the WhatsApp group and we chat for any updates and information that is regarding this course program. The QR codes are here for you. And also, as all good educators, we would love feedback. We love to know what we did well, we didn't do so well, what we could do better. So please feel free to also spend a couple of minutes of your time to actually complete our post-session survey. Because all that feedback will actually go to improve the program for not just this cohort, but those coming after you. Just like with climate change, every action matters. What we do today matters for those of tomorrow and 10 and 15 and 100 years from now on. And that's the mindset we now need. I wish you a wonderful afternoon, evening, or morning from the lands of Wurundjeri people of the Kulin Nation in Melbourne, Australia. I acknowledge the traditional owners of the land on which I live and work, the Wurundjeri and Woiwurrung people, and I am very grateful to have this opportunity to speak to you all today. Thank you also to our three speakers, Ron, Mara, and Aaron, for sharing their expertise and knowledge. We'll see you in the next session. Bye for now.